Ready to get started back? Our next topic is going to be looking at clinical documentation. So I know for many of you, this is probably what you've been waiting for. Before we jump in, there were a couple of other questions that came in that I just wanted to go through very quickly here. You will have the ability to set up the system before the conversion's actually done so that you'll set up your preferences, you'll be setting up your quick list. So you will have a database that you can start building that in before the data is actually converted. You do have the ability to email encrypted directly out of the system, direct messaging, as well as secure messaging that you can do from inside of Entergy. And unresulted orders in progress, no, it's not. Okay, your orders, yes. Unresulted orders, you will be able to convert over. Progress notes are going to need to be signed before they are converted into Entergy. So any open progress notes, you are going to need to sign off because we are going to bring those in as finished notes, but orders that are open can be brought over. There is a dental component. That would be MediaDent is the core product that we have. It does have a similar integration with Entergy as you did with Success. We also have an interface with Dentrix as well. So if there are people that are using Dentrix, there's also an interface to Dentrix or a fully integrated MediaDent. So you do have a couple of different options on the dental side. Okay, so let's jump into the clinical and we'll go from there. What I've done now is actually opened up what could potentially be your clinical view that a typical doctor, nurse, clinical staff, where they would begin their day. This would be something that would replace the clinical console functionality that you currently have in Success. This first screen that I'm looking at would be like the clinical console for an individual provider. So I'm logged on as if I'm Dr. Ford. So I can see my appointments of who's on my schedule today. Now the view that I'm looking at is only looking at the appointments that are still active, not the people that have already checked out. Those are options at your discretion. One difference, probably most of you use the appointment screen as well as using the My Next Patient screen to see where your patients are currently located or what their status is in the clinic. In Entergy, those two screens are combined into one because this first column going down the left-hand side is allowing me to see where the patient is currently located. And if I needed to change that, this is where I could go in to change them from one room to another. So now this patient's showing up in a different location. So this first column is showing me where the patients are currently at. So this window on the top left is showing me appointments as well as My Next Patient combined into a single view. On the right-hand side where it says Task, this would be like your My Task sections that you have on the left-hand side of the clinical console today, including things like your flags, your medical messages, your orders to sign off, that type of information on tasks that you're needing to follow up on, your medication refill request. So the different types of tasks would be viewed here in the right-hand upper window. You would only see the tasks that you have outstanding items for. So for instance, if you didn't have any phone messages right now, that just goes off the screen completely. You do have different options of how you look at this information. I'm looking at it a summary, just grouped into different, subtopics. But if I wanted to open up all my tasks, just so that I see them open, or if I were a nurse, I may want to see them, ordered by the patient to see the different things that the doctor's wanting me to follow up on. So you do have different options of how you group that information, as well as if I just wanted to see high priority. You also have this option that says Include Monitored. So maybe I'm looking at everything that was sent to me as Susie the nurse, but I'm also looking at the general nurse pool of things that weren't sent to me specifically, but were sent to nursing staff so that I can see things that I might also want to go in and take a look at. So you do have the ability to set the data up in different formats. Down at the bottom right would be like your encounters to sign off. These are the charts that have been started but not signed off and completed yet. So those are the charts you see down at the bottom right. The different icons you see on the left-hand side are just where I could drill further into the different sections. So for instance, some people may want to just work off of the appointment view instead of having the task on there and the encounters to sign off. So if I wanted just to see the appointments and go in and choose my patient based on that, I do have the ability to do so. If I was ready to get started with an individual patient, I could just click on that patient's name to go in, and the system opens up that patient's chart to allow me to see the details of what that patient has on their record. So I'm looking at their medication list, I'm seeing their problem list, I'm also seeing recent lab results. You can customize how the screen looks. If I say medication should be over here and problems should be down there and these different icons going down the left-hand side, I want to change the order or I want to change things to different areas, you do have the ability to do so. On the right-hand side of the screen would be information that's related to today's visit. So I could see what type of appointment the patient's coming in for. If they were seeing multiple type appointments on the same day, I would be able to see the different appointments that they were coming in for. If vitals had been entered, I'd be able to review the vitals information. Also, while I'm looking at this, if I needed to add a medication or go in, maybe I want to mark him as reconciled, I can go in and do that from here. If I needed to add a problem, I can do things like that. The health reminders, this would be similar to your clinical alerts that you create in the Clinical Event Manager today, but a big difference is that you don't have to create them yourself. The system comes preloaded with a national standard list of clinical guidelines. Now I could customize those, so maybe, I want to go in and see the list of everything that's due for this patient. I can quickly bring up that list. I can see the frequency that it's being, standardly, required, and I can see why the patient is being included in that rule. So the guideline is based on males between the ages of 60 and 70. So that tells me how the patient was included. I also have the ability not only to look at what's due, but if I wanted to see the last time we completed certain measures, I also could uncheck due only, and then I could see the completion of each of those individual guidelines. So you have the ability to customize those for your own organization, including just the ones that are important to you so that you can minimize that list. And you may have different sets depending on the specialty maybe of the provider, or maybe I just want to look at the information in a different way. So that's where the guidelines. But the big thing to recognize is you don't have to build these. Where in Success, you had to build most of those individual rules, and Entergy is coming preloaded. I also have a section here where I'm looking at any outstanding immunizations. So if I was a pediatrician, that's probably one that's very important. If I'm dealing with adult medicine, I might be just including those in my health reminders. So basic configuration of how the screen is laid out there. If I was ready to get started with documenting the visit, I could open up the note here at the top. Or maybe I say, well, I'm not ready to start with Stephen Carlson yet. I want to go and look and see who else is waiting. This list at the top allows me to quickly see who else is in process with the clinic. And I could say, wow, Jeff's been waiting for a long time. I may want to jump over to Jeff's chart. So without going back to that My Day screen, that clinical console look, I can actually change to a totally different patient and go in a different direction. So again, just looking at ways that I'm eliminating keystrokes that the user's having to do. Okay, before we open the note, I'm going to stop for just a moment because we've had quite a few questions that have come in and see if we can go ahead and knock a few of those off. Do we have to set up all of our existing patients in? All of your demographic data on your existing patients will be converted in as part of the product migration, so you will not be having to reset those up. Included in that is your clinical discrete data. So like we're going to rebuild your medication list, we're going to rebuild your problem list, your notes are going to come in as finished progress notes. Any images you have stored are going to come directly into the chart. Your lab results. So for all of these, like where I have lab results that have come in currently in the system, in Success as discrete data, they will be populated into Entergy as discrete data. Provider schedule patients. Each individual person that's working with a provider can switch back and forth between each of the individual's provider schedule, so they can see multiple providers. Lab results and things like that, they can be assigned into a pool that's going to be reviewing the results rather than to an individual. Or I can assign them to an individual but have a pool of people that are monitoring that information. So you do have a couple of different options, but yes, if you have multiple people that are following up and looking at different lab results for different providers, that's not a problem. You can create your own health reminders, or you can customize and tweak the ones that exist today. Historical data will come in directly in from Success EHS, so any of your historical problems, they will come in as discrete data. I can also add historical problems, into the PMH as well. Resizing, I'm not sure exactly what you're referring to there, Pat, but that's something we can talk about, separately. The system, is basically laid out, and depending on which things you select will be what's on your screen. Immunizations will be based on the immunization schedule. So if this was a pediatric patient, and I'll show you a pediatric patient here in a few minutes, and we'll answer that question for you. Yes, as far as wellness that's due, I can see the reminders. So if there's certain reminders that are due based on the clinical guidelines, I would be able to see what wellness is due for that patient. So you can see that. Previous wellness visits, I can see history for a patient, last visit, things like that, and I'll come back to that one. Is CIIS interfaced with that? I don't know, but if you will reach out to your account exec, they can get with you specifically with the interfaces that are available. They do have a list of ones that exist today. If that's an interface that you have now, we can certainly check into that for you. Orders tracking, and we will come back and I'll go over the orders tracking for you as well. The APMP, you do have a link for that directly from the medications, and we'll look at that here in a moment as well. So we'll come back to some of your questions as we delve further into the information. I just wanted to knock out a few of them because that list was getting long. But now let's go in and start the noting process. So if I were going in to document this patient's visit, and I'm going to open up a visit type that's going to be similar to what a lot of you are doing in Success today inside of medicine. Now, there are a couple of different ways that you can document your templates or your progress notes using templates or using something called visit notes. They are both medicine-based, so it still has that rich database of structured clinical findings that are codified, they're referenced over to SNOMED, different things like that. So we do have all of that information that's going to be available to you, but I'm going to start off with showing you more of a classic medicine template like you probably would be using today, but with some differences. There's some additional capability that you don't have today that I want to point out to you that are now available for you. So if I was ready to start documenting, I can go in and pull up templates based on my favorites list so that I could have my favorites. This would be like that, drop down of your 10 most common ones that you use, but there's not a limit. If I got 20 most common or 30 most common, I can have my own subset of the different ones that I typically go. We also have a shared library of templates that are already in place. Depending on your specialty and what type of form you're looking for, chances are we may already have a form that's very close to what you're doing, because as we were talking before, we will not be able to convert over your existing templates from Success. Those would have to be recreated, or you would have to customize the existing ones to be more like what you're looking for. But we do have a large library of templates that exist. I'm just going to open up one that's just sort of a generic type form. So if I were the nurse, maybe I'm going to start off by going into the HPI. Maybe I'm going to put in just some general notes, or maybe this is where I type in my note of why the patient's coming in today. So you can do free text to go in and add that information in, or I could also go through and just mark some of my positive or negative findings here. Noticing that when I check a finding here in the box, it automatically opens up the medicine drill down capabilities. So on Success, you would have had to have built that drill down already open inside of your medicine note, or you would have had to use that extra click to open the arrow each time. So there is a difference there. You also have the capability to go through and draw. Now that's a big ask I've had from Success clients over the years, is the ability to actually bring in a drawing. So let's say I just did a diabetic foot exam on a patient, and I actually want to be able to go in and make a notation that there appears to be a problem on this patient's foot. So I could go in and say, I want to make a notation there, and I also want to add maybe some verbiage that was 3 centimeters. And now that becomes part of my progress note today. Now, that was just an example of one drawing, but you're going to have a library of all these different types of drawings that are available to you. So I can go in and bring in all of these different types of drawings to incorporate into my progress note, as well as if you had taken a picture of an injury or a problem that that patient had or a scar, I could actually incorporate that drawing directly into my progress note as well. And if I wanted to draw on it, and that's just a logo I happened to go grab, I could draw on that as well. So any of that can be incorporated directly into the progress note itself. Now, if I were ready to go in and start documenting, again, as the nurse, maybe some of what I'm going to do is to document some of my clinical quality measures. Well, we have the templates already built to allow you to go in and document some of those different things that maybe I want to indicate I did the counseling with that patient, or there's something on the blood pressure that I want to indicate. So I can go in and document my clinical quality measures here. You also, if there's any of the meaningful use type measures that I wanted to go through and mark off, I can do things like that. You also could have your MIPS measures that were tied in there, your behavioral health screenings, and I'm going to go back out and show you a few of those as well. So like if I wanted to go in and maybe look at my PHQ-9, and I could have that linked directly into my template as well. So I could go over and do that. I could have that information, document those at the same time that I'm going through and documenting. If there was a particular problem that the patient was in for today, I might want to go into my upper respiratory, for instance, and say, why is the patient here today? Will they have a cough? They're coughing up blood. They're also wheezing. I'm hearing some rhonchi and some rels, so I can mark off those different findings. I then can also go through and mark if there's some tests that we performed today on that patient. If I wanted to select the diagnosis, very similar functionality that you're accustomed to using today inside of Success. One big ask that I've had from my Success clients over the years is while I'm in the middle of documenting a note, I need to maybe go look at the flow sheet values, or the patient's referencing something that happened on the last visit. I don't want to have to leave my note and close it. I want to be able to jump over and read a previous progress note. At the same time, I'm still working in my medicine note. Or I want to be able to go and look at my flow sheet values. The patient's talking about they think they're doing better on their cholesterol. And I look and say, well, maybe a little bit, but not a whole lot. But I'm able to go in and look at information while I still have my note up. So that if I needed then to come over and continue to document, I can do so without actually having to close out the note. So you do have some different options just by using the option here at the top to split the note so that I do not have to leave the progress note to go over and do things. For any of you that are using medicine lists today as a quick way of documenting, those in Entergy are called favorites, where I can bring in, so if I say, well, bring in my standard review of systems, then it actually added that review of systems into my progress note just by making that selection. So for any of you using medicine list, you absolutely can do that. There is a mix of list and forms that you can utilize, but we cannot bring them directly over from Success. You would have to rebuild those and recreate those. Health reminders can be linked to specific orders, and I'll show you an example of that here in a moment. So you can do that, and you can activate them directly from that guideline. We cannot bring the templates over. I wish we could. I know that's a common question I get from all of you is, can you do that? The PDMP, if it is state specific, speak directly with your account executive to understand what's available if there is a specific state database that you're interested in talking about there. Flow sheets, you would have to recreate your flow sheets, but the data, the discrete data is being brought across. So let's say that, on the flow sheet, we'll just use the flow sheet as I may have all my standard lab values just brought into my flow sheet, but if I wanted a flow sheet that was specific to diabetic, well, I would need to go and create what the values are that I wanted to have included on my diabetic flow sheet. But the data that you currently have in Success would auto-populate to those fields once you had built the flow sheet. So you do have to recreate the flow sheet, but the data will auto-populate directly in once it's been built. Okay, so you would have to recreate your favorites list and things like that. You can bring in from a previous encounter, like you're accustomed to being able to do. One thing for pediatricians, you do have the ability to bring in family history from one child to another within the same household. So if I had 4 kids, same parents, and I didn't want to have to rebuild the family history every time, I can import it from one family member to another. So you do have some options there that can save you some time. If I were done with the progress note at this point, and I was ready to go over and review the charges that I had done on the patient today, I could come over to orders and charges. And this is going to consist of several different aspects, but this would be replacing your eSuper bill. Okay, so your eSuper bill would be replaced by orders and charges. So if I were looking to add a new diagnosis that I did not select while I was inside of the template itself, I could come in here and select it, and it adds it directly. I also could select a previous diagnosis. Instead of going up to your import patient problems, the patient's current problems are going to be listed here, and if I want to incorporate them into today's visit, I just click it. Now it's part of my orders and my diagnosis for today's visit. Also notice that any selections you made while you were inside the medicine template, I can just tell the system to place those into my eSuper bill for today, so that information will auto-populate. Another key element, though, is something called predictive orders management. Entergy has what's called machine learning, where it's going to be learning from the way your doctor typically treats a certain diagnostic problem. So in this case, I've highlighted hypertension, And here in the middle section, it's saying, well, 86% of the time, you treat that problem with lisinopril. You also typically order a CBC and a lipid profile. And so without me doing, going to a favorites list or a pick list or an order set, I said, well, go ahead and let's get those medication ordered. Let's get those labs done. And I'm ordering all those directly from the system, having learned how I normally document that particular problem. Now that means when you first get started, those things aren't going to be there. But after you've seen your 5th hypertension patient, then you're going to start seeing the tracking of how you typically treat that type of problem. Now let's say you're seeing a patient that you don't normally see, a certain diagnostic category, but other doctors in your practice do see that. I could switch over and say, show me what all the providers do to treat that particular problem. Or maybe I know Dr. Ford really does a lot of those and I want to see what they're doing. I could switch and look at another provider and see what their preferences are of how they treat that problem. So you do have some options of how you can use that type of capability for the system. And as we move toward the additional innovation that we're adding into Entergy, some of you may have heard us talk about something called Project Polaris. Well, that's not a different product. That is just adding additional capabilities, new technology, new innovation to Entergy. So as we continue to develop more of that, with every update and release that you get for Entergy, you're going to continue to have more of that capability of what we call Project Polaris, which is that innovation that we're adding, more of a modernized look and feel. And so as we continue down that path, we're also adding more machine learning into that tool. But this is where, if I were going through documenting, now I've chose a diagnosis that was not ICD-10 specific, so it asked me for, is there a more specific code I should be using? If I needed to go in and write a prescription, and someone earlier was saying, is it easier to use the medications? I just wrote a prescription because I just pulled it directly from my favorites list. If it was a medication that I don't typically prescribe and it's not on my shortcut, then I could come in and search for that. Then it's going to open up and allow me to complete how I would normally do that prescription. It fills out the quantity based on the number, I'm doing it twice a day. Prescription is going to have the patient's preferred pharmacy saved, prescriptions written. I do not have to leave this window and open up the medications module in order to write a prescription. I can do it directly from here. Instead of going to pick list, these would be your pick list. These are your favorites of the common orders that you typically do, including things like referrals out. So if I were needing to do a referral, all of those things can be added directly to your charge ticket from here. If I were done with that patient, I can save that information, and then the system's going to run through, and I told it to do the drug-drug interaction as part of that process. So it's checking for that. It also has formulary checking that it can do. It also can be doing PBM. If any of you are doing the Pharmacy Benefits Management tool, you have that available to you. But if I'm going through and the system's done my drug interaction checking, but I need to add a notation as to why I'm okay with prescribing this, this will be another example of that quick text, because I may have some of those things that I typically say when I'm going through and, overriding that I'm going to do this. So I could go through and pick that instead of having to type it every time. So another example of using those macros. So I do have the ability to go in and do things like that as well. It just sent my prescriptions electronically for me. I did not have to go back up to the ERX button and click that in order to send the prescriptions. That's just part of the process. I also had a referral that was part of my orders. So I wanted to open this one up to show you where the system auto-defines the different types of orders to whoever you've said that task should go to. So in this case, I've said, instead of sending it to an individual, I want to send it to my front office pool. So now that is going to be showing up in the queue of any of those users that would typically address that type of problem. So I can have the system, and for any of you that use patient correspondence and you have your own custom forms and documents, you do have the ability to create your own referral documents, different types of forms, your return to work, return to school, things like that. So you do have the ability to set those types of documents up and those be attached specifically to the orders. Those orders, like that referral document, if a doctor does it themselves, they could do a send now directly from there and actually fax it or send it via direct messaging if you're doing direct messaging, or I can assign that task to an individual user. So that's sort of the classic way that many of you may be documenting today using a classic medicine type format. So that's your option, but I also want to show you another way that you can document using something called VisitNote. VisitNote, again, is based on medicine, and I'm just going to, I'll tell you what, I'm going to start with a blank one just to give you a better feel for this. So I'm just going to do a new form here. And someone was asking a moment ago how you would go about putting in your chief complaint. So I was going to jump over and show you this as well. So chief complaint, I could have a field just like this, and this is an example within this VisitNote look, but you also could have a field at the top of your medicine template as well. So I could go in and type as to why the patient is coming in today. So I could go in and indicate the chief complaint, you know, for 3 weeks, type in whatever notations I need to make there. I can see the vitals. If there were recent lab results, I could also see the recent lab results seen here. Over on the right-hand side, these visit notes are going to be more similar to like Medicine List, or for those of you that use P&G, the progress note generators. Those are more sort of in line with that type of concept. So since the reason that the patient's here today is a headache, I may want to bring in my headache template. And it may be that I want to bring in more than one form. I may say, well, bring in my medicine my neurology headache, but I also want to bring in my standard order sets. And someone was asking about order sets earlier too. Order sets can be built directly into the progress note. So in this case, if I wanted to say, well, go ahead and order all of my normal annual male exams, one click, I place the order just like you do with an order set today. So you can go in and do that. But this just brings up a different format of looking at the information. So maybe for a reason of visit, maybe I already had that to where I just wanted it to default. If not, I can answer that question. You'll notice on HPI, it's asking me some of those, you know, typical questions that you might want to go in and ask. What was the severity? Well, let me go through and add some of those findings. A couple of differences here. One thing I've had many people ask me for over the years is the ability to change the way medicine outputs a finding. I don't like the way it words something. Well, let's say that they're wording this as the worst the patient has ever had, and I don't like the way it says that, and I just wanted to say the worst ever. I can actually go in and change the output of the medicine finding. Now, it does not change the finding itself, so for reporting capability, it is still linked back to the original medicine finding, but I can change just the wording of the output of that if I choose to. And if that's something I said, well, I always like the way that you can go in and want to be able to do that, then I could actually go in and say that I want to save that to my master form, and then it would always output that information in that format. Okay? So you do have the ability to go in and make your own changes to it. But this is where just a different form of documenting. I can have information auto-cited into my note, like my social history, my past medical, those are options. As part of bringing in one of these pre-filled notes, like you see, all of these things are in the standard font, are things that I've automatically populated into the note. The ones that are in this italic type font are not. So those are things I may want to go back and add some additional finding for So I would just click on those sections if there's certain things that I want to add to. Physical findings, I have the ability to document those, go in, select my diagnosis. So just a different look and feel. And I have some people that say, oh, I much prefer this type of look and feel. Others that really want to do the templates. Totally up to the individual depending on what they want to do. Okay. Okay, so let's stop, and I'm going to go back through and look at the questions here. We talked about the chief complaint. Recommended workflow to update the items on the problem list. I'll go back and show you the problem list, and we'll look at that here. The limits inside of the medications, a lot of those are based on SureScript requirements. So if SureScript has a limit of 140 characters, then that's what it would be. I'm going to go back to medications here and answer another question someone had on the PMP, so we'll go look at that. Pharmacies for medications, let's go into medications and we'll take a look at some of those things for you. So if I were going in and wanted to prescribe a medication, so let's want to open up one of these, and this database may not have the PMP, but there is a button that can be available here for a link to the PMP for you, so that you could see it from the medications, and I'll try to look for another patient here in a moment, see if I can find one that you can see that. But if you were going in to do a prescription, this is where you can do it. I can see the default pharmacy for the individual provider, but if I wanted to do a different pharmacy just for this one prescription, I can also maybe go select a mail order. We do use SureScript, so all of the SureScript pharmacies are going to be preloaded for you, and you would just use those. Are you able to create a QAT? And I'm not sure what the QAT you're referring to is there, so if you want to add some clarity, we may can come back to that question. You do have current forms, current patient education. We use Medline Plus is the database that we use for patient education, so those are available. You also can set up your own forms in correspondence where you can set those up. So if there's additional things you want to add, you have the ability to do that. Can you remove the ones not needed in the notes? I'm not sure what that question is referring to, what things you're wanting to remove. If you want to add some clarity, I'll come back to that one as well. You can change output for new forms. You absolutely can. Here in the visit note, you can change what that form is going to look like. Doctors First, I'm not sure if you have to re-register or not. We would have to check on that. I'm not sure about that, but your account exec can check on that for you as well. Patient eligibility is already part of Entergy. For any of you that were with us this morning, we looked at that a little bit when we were on the practice management side. You do have to hit the save button on the medicine note. So that is going to be a change for you that currently, it's my understanding in Polaris that save button may turn into an auto save, but right now you do have to hit the save button. And I don't know about that timing for the SPI. Again, if you'll get Missy, if you'll get with your account exec, they can work through that question. How do you print the drug information? I'll go through and show you that here as well. The medicine forms in Success cannot be migrated into Entergy. We do have a large library of medicine forms, but you would have to customize, tweak those, or create your own. We cannot, unfortunately, bring those over. And different medication formularies, yes, those are built in already, so those things would be available to you. Okay, just wanted to catch up on some questions. So. All right, so we did have a couple of people that wanted to see what the final note would look like. Excuse me. So I'm going to go back into the note, and I'll go in and show you what the final one looks like for this one that I was just working on in the visit note format. So you would just turn on this preview option, and then this shows you what that note potentially would look like. And you do have some ability to do some customization, but this is just one option of what that note might look like. And you can have sort of a similar look and feel in the encounter note. The first one we did that's more the classic medicine type look and feel that you're accustomed to today. So you do have some different options of what that output might look like. Okay. Okay, so if I were finished, E&M calculators also available, same type calculator that you have today where it's counting the number of discrete findings that you did in each of the individual sections. You also, on the orders and charges, I think we talked about most of the things over here, but if there were any specific tests, these different sections, you can change the name of these items here. If the doctor wanted to do a follow-up and they wanted that to be seen over by the your staff at charge entry, that follow-up note would show up for them there. Diagnosis codes, it does do checking. If you're choosing something and you have not done a code that's specific ICD-10, it will stop and prompt your staff to double check that. Any orders that are being placed would be showing up in the task list of the individual users that those things are being assigned to. So the different tasks would go back to the provider, to the nurse, to the referral coordinator, whoever the appropriate person is that should be following up on that task. Now, as a provider, if I was finished documenting on that patient and now I wanted to go and maybe see some other things that required my attention, I could come back to my medication request list to go in and work some of those items. So if I wanted to go in and maybe decide if I was going to refill this particular prescription, I can go in and see, you know, what that prescription looks like. Now I have mine defaulted to where it opens up this yellow information window beside me so that when I'm looking at the task, maybe I want to see some basic information on the patient. I want to see their home information, who their preferred pharmacy. Maybe I want to know the last time I seen them and do they have a future appointment scheduled. Also, maybe I want to look at their insurance information. So you do have the ability to see key data elements at the time that you're trying to decide what to do with filling that order maybe. If I want to refill that prescription for them, but I want to authorize it with changes, I would click Authorize. If I want to accept it as is and just go ahead and refill it, I would use the Quick Authorize. If I want to deny it, click Deny, of course. Or maybe I want to send it to my nurse, and this is another example of where I can use that macro to say I don't want to type it in because that's something I tell her all the time. I just want to forward that to her. And then by default, I have mine set to say, you know, don't keep it on my list. If I've sent it to my nurse, I'm done with it. But you do have the option to check that and say, I do want to keep it on my list. So you have the option to keep it on or not. When you're looking at lab results, this is where I could go in and say, I want to look at my lab results. One difference and another thing that I've been asked for by my success clients for a long time is when I'm reviewing labs, if I ordered 5 different tests on the same day that were all requisitioned together, I want to be able to review them all at one time and not have to open each order individually and sign off on it. So if I had multiple tests requisitioned together, I could sit here and review them as a group and sign off on them as a group. So you do have the ability to see that information. If I needed to forward that information over to someone else, again, another example, patient needs an appointment, so I'm sending that to my nurse so that she can take care of that for me. So as an individual provider, this is where you would be going in and looking at the different aspects of the tasks that you need to be following up on. Now, I want to show you a couple of examples of some different types of patients. One for my pediatricians. If I were looking to go look at a growth charts are built into the system. Couple of differences from Success is that you do have not only full term, but you also have downs and preemies that are available to you. And you have the option of looking at the CDC format or the WHO, so you do have those capabilities as well. You also have your immunization schedule where I can see the immunizations that are due for this child, and I can see the schedule that information is being based on. You can customize that schedule, so if you do something that's a little different, that's not a problem. This is also where you would go in to record your historical immunization. So if it was a new patient and you needed to put in their history, or to administer any that you were giving today. So you can go in and do a couple of things that are unique to that individual. Now I'm also going to switch over because I may have some folks on the line that are also doing obstetrics. So I just want to show you very briefly, oops, wrong doctor, one sec. I want to show you a doctor that has some obstetrics set up here. So if I were dealing with obstetrics, I can go in and actually look at the OBGYN type format, the prenatal form. So this would allow me to see the information that I had put in that flow sheet previously so that I could track what their prenatal history had looked like. If this was a new patient, I would have entered the initial visit information, including the OB history, medical history, the genetics, and then of course done the initial physical exam for them. Any risk factors or risk diagnosis would be noted here. Any labs, education, health, basic information that you're doing on the flow sheet. If the delivery had already occurred, I could go into delivery information and I could log in, if it was multiple birth, I could go in, put in the information for each individual birth that had occurred. Postpartum information, there's also a tab that allows you to capture what those standard obstetrical postpartum visit might look like. And if I wanted to print off a copy of that prenatal history, maybe to provide to the patient starting at 36 weeks or something, I could actually print off a copy of their prenatal history and provide that to the patient as well. Okay, we've got a few more questions that have come in. How do you order labs? We did that as part of the eSuper bill, and then the requisition process is part of that order. But let me go back over and I'll go back to that patient we were dealing with a moment here. Okay, so if there was an order out there, or if I were going through and placing an order, on that same screen as I'm placing that order, then I have the ability to say I want to create that requisition. So the lab order button up here is where I could go in and produce the requisition. It's also, if I wanted to defer that to a future date, I can also do the deferral directly from there. Or if my internal process is just to print them a copy of the order, you can do that from here as well. Immunization registry should all come over if that is existing in your state today. Double check that with your account exec, but you should find that we have all the different immunization registries already in place. Automatically input the OB history. I don't believe it automatically comes in from the medicine, but we can double check that for you also. Patient correspondence, yes, correspondence is a part of Entergy today. So for this patient, if I wanted to produce a certain document, now these documents could have already been tied to orders as well, but if there was a certain document that I needed to create for the patient, maybe a return to school, return to work, you can create those correspondence documents and have those available to your staff, and those are editable documents. Now there is one difference. The signature pads that you're using today, you would not be using. You would have to use a third party for your signature options on like your consent forms, other than using the standard signature pad. So there will be a difference there. Okay, if I were wanting to go in and update the problem list, here I can see what the patient's current problems are, so I can see what their problems are, but directly from the face sheet, if I were wanting to update their problem list, I've got a patient that doesn't have any. One sec, I'm going to switch patients here. One sec. Let me get a busier patient so he doesn't have enough. Okay, so if I go into this patient's problem list, directly from the face sheet, if there was a problem that I needed to make an update to, I can produce history, I can put in reference information, or if I wanted to edit it. One difference also in the problem list is this self-limiting. So if I had added something that I know is an acute problem, like I don't know, a cough, and I want it to automatically fall off, then I can make that self-limiting, then it will automatically fall off the list at some point. But if I needed to update the problem list, I can do it directly from the face sheet, or I could come into the problem list and I could update problems from here as well. Same options, just two different ways to approach it. Ordering labs when the patient is not in the clinic, you would have the same type concept of the non-billable encounter, similar functionality. So if they were not in the clinic and I needed to go in and set up a new encounter so that I could go in, that's where I would go in and decide billable or non-billable, but the concept is very similar to the non-billable. How does a provider add their signature to an order? The system automatically signs things as they're going through, but if you're talking about an actual physical signature, let me check on that for you to find out exactly what the recommended workflow would be. Okay, care plan module. So we're going to open up that at this point. So if I wanted to go in and see the patient's current care plan, and that could be interdisciplinary, so it might be that, you know, if I have behavioral health, that could be part of this, but I could see the health concerns that we're currently addressing. So in this case, we're working with them on increasing their regular exercise. The reason is that for that is BMI, some of the interventions, the tasks that we're asking them to do, and then what the evaluations and outcomes have looked like. You can have quick text that I could bring in some of the things that I standardly do, or I could type in that information directly in. In this case, this patient is also working on their blood pressure. So again, you can go in and set up care plans that model, and you can set up your own quick text and some of those default values that you want the system to automatically bring in for you. So you do have some different things that you can do, but this is just an example of what a care plan could potentially look like. And you can incorporate those types of things into your note as well. Okay, I think we have again gotten up to our time stop here. So hopefully that gave everybody a pretty good feel for some of the capabilities inside of the clinical module. I'm sure we didn't answer all the questions, but we wanted to at least give you the big feel. It looks like the next section that we're going to be starting with will be patient portal and patient messaging. And we will be starting that at 3:30. So again, you have about another 5-minute break, and then we'll be ready to get started again.